It's a pleasure, as always, to have Dr. Johnson and Melissa back with us on the program. First of all, Dr. Johnson, why is it if a child passes a school screening for vision that the child's vision may not necessarily be fine?
Okay, well, I guess when we talk about screenings and where people might be obtaining the vision screenings would be at their eye doctor's office, be it an adult or a child, or a pediatrician's office, or at school. And a lot of people will come in and tell us, well, I have my eyes tested every year when I go have my physical. My son or daughter, kids get their eyes tested at school. Kids get their eyes tested when they go to the doctor. And so the reason, to answer your question, that that's not a complete exam is because really what they're testing is how well they see letters on a chart, which that doesn't detect if there is strabismus or lazy eye amblyopia many times, because if a child has a problem seeing, many times they're afraid that that means there's something really wrong. And we're talking about kids. Now, adults, maybe they're not as afraid, but they're assuming that if they see well that their eyes are fine. And with children, sometimes they're afraid if they can't see it, they try to memorize the letters, or they will either not be able to see it or maybe peek around with one eye that's better. But basically on those vision screenings is pretty much really limited to a very basic test, and that's reading an eye chart. And we know that that's not a comprehensive exam because nothing else is looked at from the standpoint of reasons why someone may have a vision problem or go undetected because it's simply a screening.
Dr. Johnson, could you talk about some of those refractive errors of the eye?
Yeah, refractive error, a lot of people might not understand what that means, but refractive error is kind of an internal word that we would use, and it references whether or not somebody's nearsighted or farsighted or needs help to see to read or has astigmatism. So refractive error is what amount of correction that we find would compensate and allow someone who's farsighted to see, allow someone who's nearsighted or someone with astigmatism or reading problems to see with a given correction, which would be grounded to a lens, put in a pair of frames, so they could then see to function for whatever it is they're having difficulty seeing.
And in this day and age, with children and going to school, they've got to deal with smartphones and tablets, and their parents, maybe when they went to school, smartphones and tablets were not a part of the equation. So how does that change the equation? I'm using that word quite a bit when it comes to how a child's vision in today's world is really affected by these smart devices.
Well, I'm going to defer to Melissa in terms of her experience with her children, and I have some things to say about that too. So why don't we start here with Melissa answering that from a mom's point of view?
Sure. Well, yeah, definitely they're exposed from a very early age to all types of electronic devices. I mean, they don't really even have blackboards in school anymore. They have the whiteboards and the digital boards that they have at school, as well as their tablets, their computer screens, their handheld devices, their phones. So they're pretty much always being exposed to these electronic devices. And what's been found is that these electronic devices, they emit what's called a blue wavelength of light, which can be damaging to children's eyes. But also there's an increase in near close-up work that children may be having a difficulty with that wouldn't necessarily be caught at your vision screening at the pediatrician's office or at the school vision screening. So yeah, there's a lot of different aspects that would definitely affect the children's vision as far as the technology goes.
And Dr. Johnson, I didn't know if you wanted to add anything to that as far as how modern technology is really changing the landscape when it comes to children's vision and how you monitor that and evaluate that.
One of the things that we do always is we check the health of the back of their eyes with digital imaging, and then that's always something that the parent wants to see, because then we explain how the vision system works and that glasses don't mean that your eyes are healthy. They just compensate, as you mentioned earlier, refractive error. We spoke of nearsightedness, astigmatism, farsightedness, and reading difficulty. So we explain to them how, if they do have a need for correction based on their eye health, whether or not that is a healthy environment for light to focus, or if there is an encroaching health problem. As far as us then examining the patient, determining whether or not they need a prescription, whether they don't, and in many cases they don't. In many cases they may not need a change of prescription. In many cases they may wear contact lenses. And in most all lenses, until most recently, researched, which you can go through Harvard Review and you can Google search blue light, as Melissa has kind of touched on, which is emitted through electronic devices that we tell patients, be it tablets or phones, which we know everybody's on, including adults, but we tell our patients that the damage that's occurring inside the eye health, where light can focus with glasses, is slow and it's not detectable. And so for any patient, including children, but especially kids, because they're just about are weaned on a phone, and that we tell them that in their lenses that they should have some type of blue light protection, even if they don't have a prescription in a clear lens, potentially in a reading lens, in a nearsighted prescription lens, and that protection is something that has not been thought through when people did all the electronic engineering and the information technology experts when they designed all these devices for us to function and do our work day to day. And unfortunately, it's been hurting our vision in two ways. It's been making people get worse in their need for correction in glasses or contacts, is what we see. And it's also been slowly damaging the area that light focuses, that allows them to see. And so now we know better. And so Apple's coming out with a new phone that says blue light protective, but we discovered it's only 30%, which again amazes me. They didn't do this when they first designed the technology, but again, maybe people just weren't thinking about it. If somebody does not need a change in prescription, we still recommend they change their lenses out to have this blue filter put in the lens. And it doesn't look blue. Sometimes people are worried, well, lenses are going to look blue, or is the world going to look blue? And it does not. But it's 90% protective, where the others, even apps on computer screens, some people will come and say they use, or they'll use a screen over their screen, which does filter some or reduce glare, but they're only about 30% protective. So we've done a lot of research here in our lab, and this is something we specialize in, is to find a product that will give at least 90% protection from blue light absorption into the eye, which is found not only through our electronic devices, but out of doors. And many parents aren't thinking about their kids wearing sunglasses outside, and it's hard to get kids to always do the right thing in terms of protecting their eyes, because kids are kids.
Dr. Johnson, we are at the beginning of the school year right now, and can you talk about the free kids vision screenings that are going on in the month of August? And not only that, can you talk about the importance of these vision screenings and how this could really be, I know we've talked about this in previous interviews, but how important it is to get children correctly diagnosed for vision problems early on in life?
Okay, that's a good question. First of all, we don't want to confuse people, Vance, as you touched on earlier in the beginning of the interview, in terms of screenings and complete eye examinations. And so what we've tried to do is to create an awareness with your help in educating the community. And so the start for a lot of people would be, well, I don't know if I need my eyes examined. I think I see okay, or Johnny hadn't complained. So we've tried to give like a soft introduction to this by providing vision screenings, and maybe getting people, because there is no charge for that, and getting people to come in and at least let us more professionally, with time, in an exam room, in a professional environment, really see if they have any eye health problems, because we're going to take pictures of the back of their eye. We're going to see what a potential prescription is through an automated computer, and then we're also going to have them read. And with those three things in combination, we can determine if they need further testing, which it's always good to have a comprehensive full eye exam every year. But lots of times that's a way to allow people to understand and visually see photographs and things like that we, again, are doing for no charge to help the community, whether people have insurance or they don't have vision insurance. And so that is the way we introduce it, but we're not trying to make people think, as we've just touched on earlier, that a screening replaces a comprehensive eye examination. It's just kind of a way to get people knowledgeable as to whether or not there's an eye health problem or an actual vision impairment.
Could you talk about the school supply drive that is going on at Eyewear Gallery?
So, we'll be doing the vision screenings, the free vision screenings on Fridays between 2 and 4, and people can give our office a call, get that scheduled. We'll also be collecting school supplies to help out children in the area that just don't have access to adequate school supplies in Memphis area schools. So we'll be collecting school supplies as well, so people can just bring those by our office anytime. We're here Monday through Friday, 9 to 5, and Saturday, 9 to 3:30.
And finally, where is Eyewear Gallery physically located, and what about contact information as far as email addresses and phone numbers, websites, so on and so forth?
Yeah, we are at 428 Perkins Extended, near the corner of Perkins Extended and Poplar, and our phone number is 901-763-2020, and our website is www.eyeweargallery.com.
And before we go, is there anything that either of you would like to add about Eyewear Gallery and the services that it provides?
I think both of us probably have some things to say on that. With Melissa, she's done a fantastic job of kind of reaching out and connecting and us getting together and talking about what are the different areas in the city that we can reach in terms of being sponsors that help kids or that have a connection to kids or programs, and those being the theater and music, literacy council, food bank. And so we are involved with all of those different types of organizations, and in so being sponsors are taking some of the provisions of those and trying to put on some activities, but we're trying to take advantage of some of the benefits that they're giving us as being sponsors of these different organizations that we've mentioned that Melissa's reached out to, done a wonderful job, and including the Grizzlies, we're working with their foundation, and to provide some tickets to kids in need in the community that might not have access or ability to go do some fun things. And that being part of, I think, who we are. Mm-hmm. So besides all the information we're giving you, we very much are very passionate about the education aspect of vision, and we also like what we do. And then we like giving back to the community, and especially in ways that we not only give back to the different organizations that are wonderful for the community, but by being able to utilize some of the tickets like to different plays or music, and then having a little party get together and providing tickets for those kids and families, and that we would then host ourselves as well.
Thank you so much. We've been speaking with Dr. Warren Johnson, a medical optometrist, and Melissa Moore, CPO of Eyewear Gallery here in Memphis. This is Eye on Vision.